Okay, everybody, I apologize for all the technical difficulties we are having. I'm very sorry this never happened before. Unfortunately, what's been happening is that we had almost 1,400 people register for this presentation. So I'm gonna try to, so let me try to take care of some technical issues and see what we can do. So if you just give me one moment, but bear with me, I'll try to figure out what's going on. Hey, Jamie, so I'm glad you're here. Sorry, we're having massive issues and I can't seem to solve them. So we're just gonna go ahead and start because I'm already 5 minutes over, but apparently it keeps telling me it's preparing to live stream on Facebook, but it's not live streaming and I can't do anything about it.
Okay, all right. Well, thank you. We'll go ahead and start.
Yep.
Welcome, everybody. I'm Jamie Lynch, the president of Build TE. We're a parent support group for parents who have children with all types of learning differences in Tredyffrin-Easttown School District in the western suburbs of Philadelphia, Pennsylvania. We support parents who are concerned about their struggling children, as well as parents who have students somewhere in the special ed identification and evaluation process. In addition, we help parents who have children with current IEPs, 504 plans, and gifted IEPs. Build TE also offers parents access to expert speakers through monthly meetings, parent socials, as well as a safe voice in our school community. Our website is buildte.org. We are so glad you've joined us this evening to hear our amazing speaker, Tatyana Elleseff. Tatyana is a bilingual SLP, speech and language pathologist, specializing in issues of multicultural, internationally and domestically adopted at-risk children with language and literacy disorders in school and private practice settings. She has published in a variety of journals, as well as presented for a number of national and international medical, academic, and nonprofit organizations and speech-language hearing associations. She is a clinical instructor at the RWJ Medical School Department of Psychiatry and a clinical supervisor at Rutgers Day School in Piscataway, New Jersey. Tonight, Ms. Elleseff will review the role of language in the acquisition of reading and explain why children with reading difficulties must be assessed for language deficits. She will explain how undetected language deficits can adversely hamper reading, spelling, and writing interventions, causing the student to plateau in their literacy gains. Finally, she will offer suggestions regarding which assessments should be considered by parents and professionals for students who exhibit persistent reading difficulties. I personally am grateful to have met Tatyana last year when she presented at the Pennsylvania branch of the International Dyslexia Association Conference. Tatyana is generous with her knowledge, time, and resources to help both parents and professionals find answers to often very difficult questions. And here's Tatyana. Thank you.
Thank you so much, Jamie. So sorry, everybody, for all the technical issues we're having today. Unfortunately, there has been far too many people registered and nothing is cooperating with me today, neither Zoom nor Facebook. So I apologize sincerely. So what's going to happen is this video, I will upload it on Facebook in the hopes that after the fact, and then it can be shared once it's done. But right now, so unless somebody has any suggestions, I'm gonna share my screen and show you what essentially I am seeing. So usually I would get a notification that it's ready, how do you want to post it, and so on and so forth, and yet I'm getting absolutely nothing. I'm getting a dead screen, and I tried doing this a number of times. So unfortunately, this is a bit of a disaster, which I didn't anticipate, but we're just gonna have to power through it. And since I do have, the video recording in Zoom, I will be able to post it, and then I will investigate what happened. Okay,
Thank
so
you.
Without further ado, why don't we begin? Jamie, would you like to stay as a panelist, or would you like to go back? What would you prefer?
Why don't you take me off? I'll go back into the chat and I can participate there.
Oh yeah, okay, perfect. You know what? Just to be on the safe side, I want, because so far everything else has been going so well. You
stay. It's fine.
You stay, because if I remove you, I don't even know what's going to happen. The entire Zoom is going to
totally fine. I'll just stop my video and mute. So
okay, perfect. Thank you so much. Okay. All right, you guys. So here's again. I'm so sorry, and I apologize for all these interruptions. This is literally the first time this ever happened. So. What we're going to talk today about is how language impacts reading. And it's actually a very monumental, way that it does so. So when we talk about oral language and we talk about oral language development, we're talking about the hierarchy of development. You first process information and you listen to information before you speak. You learn to speak before you learn to read. Brain is wired for speaking, but brain is not wired for reading. Reading, spelling, and writing need to be explicitly taught. They are evolutionaries. From an evolutionary perspective, people have only been reading and writing for a far less time than people have been speaking. And the brain is just not wired that way, so it needs to be explicitly taught. Now, oral language develops along a continuum. So these abilities, or language abilities, serve as a foundational framework for the development of later, more complex abilities. And that includes, such as writing composition. Learners who are going to be struggling in the area of literacy, reading, writing, and spelling, is that they may have unrecognized and undetected oral expression and social communication deficits, which are adversely impacting their literacy acquisition abilities. Before we delve into the nitty-gritty of language, let's talk about, how language is acquired. Language is acquired through several different ways. So language can be acquired through implicit learning, explicit learning, as well as statistical learning. And let's talk just a little bit about what that means and how it is relevant. So one way language is acquired is statistical learning. Statistical learning is the unconscious process by which we learn the patterns of our environment. We learn that there are certain probabilities that events will occur or co-occur together, and that happens in certain sequences. Language has many statistical properties, and on the left-hand side of my page, you see some examples of those statistical properties of language. You see examples of phoneme positions. H does not occur at the end of words. Phoneme and letter transition probabilities. Certain sequences are rare as compared to other letter sequences. There is a certain syllable stress as related to pronunciation. Depending on what part of speech you are using, you will pronounce words like record and record in a different way, and so on and so forth. So those are the example of certain things we acquire when we learn language as we're picking up on these patterns. Vocabulary learning, as well as spelling, as well as reading, are very much have statistical properties. Vocabulary learning is statistical. Children with smaller vocabularies, they don't simply know fewer words. They actually know a lot less about language and a lot less about the world. Words are statistically linked to other words and to other levels of linguistic representation. So words carry information about the sentences in which they occur, and so on and so forth. So that makes it, so this is a very important point, because we all learn by statistical learning, but not everyone learns as efficiently. And children with language impairments and children with language difficulties are going to have, lots of, they're going to have lots of problems acquiring that. So now let's talk about, explicit and implicit language learning. So when we talk about explicit versus implicit language experiences, we're talking about ability where language is learned in terms of complex and subtle regularities which underlie language, that is learned without even realizing it, almost like in a subconscious manner. So in other words, we have little children. We have little, 2 and 3-year-olds. And a lot of what they pick up is not necessarily by somebody putting them at a desk and a chair and teaching them. They pick up by observing their environment. They pick up by speaking to, they pick up by speaking, interacting, communicating, imitating, and so on and so forth. You can also, of course, learn by explicit experiences. Somebody can give you instructions, somebody can give you feedback, you get to explore your environment, you get to discover, and that explicit experience will be very heavily teacher and caregiver mediated. So that students with language and learning needs will require explicit teaching opportunities to acquire the necessary language abilities. So children with what we call a developmental language disorder, or children with DLD, or children with learning difficulties, they will need those explicit learning opportunities. They need to be taught a number of concepts, a number of things that their peers acquire automatically without active thinking, because it will require them to have more effort. Let me stop sharing for a second and take a look at some of the questions that people are asking. So let's see. We have, okay, I've been asked, so here's one question. How are statistical and implicit learning different? Implicit learning is subconscious, and implicit learning occurs without you thinking actively and consciously about it. In contrast, statistical learning is the learning of patterns, the statistical learning is the learning of patterns, and that is a more conscious effort. You're basically paying attention to your environment, and you're trying to pick up information from your environment. And that would be an example of the difference between implicit and statistical learning. So we have that, we talk about that because the way children are picking up language is very important, because children will present with difficulties. Children will present with difficulties picking that up, and that needs to be uncovered. Okay, so So what happens when language learning is impaired? Well, there are going to be significant differences in how the child is communicating, expressing self, reading and writing as compared to other children. So deficits may be very obvious, or actually deficits may be really quite hidden. There's going to be difficulty formulating sentences. That is something which is very, very obvious and something very overt. You'll be able to spot it right away. But something such as comprehending and using subtle and ambiguous language structures, such as ambiguously worded sentences, that may not be as apparent, and that can only be teased out during testing. So we may not be able to uncover that and readily say that. So the child may have very impressive lexicon, the child may have terrific, robust vocabulary, knowledge, but they may not use it appropriately. They may use it incorrectly. So what happens is, they may formulate sentences which may not make sense, because they may be using these sophisticated words but completely incorrectly. They may be using vocabulary words very inappropriately, and that may be a problem. I wanted to talk briefly regarding terminology I use throughout this presentation. So when we refer to kids with language impairments, the accepted terminology is to refer to them as having DLD, Developmental Language Disorder. That is something which this term has been endorsed in a consensus study involving a panel of experts, specifically the Catalyze Consortium by Dorothy Bishop and colleagues. So prior to 2017, and prior to the results of the Catalyze Consortium, there was a wide range of terms used. There were a lot of overlapping labels, everything was confusing, there was poor communication, there was lack of public recognition, there was denial of services, so it was really quite a bit messy. In North America, we never quite adopted this term. We use the term SLI, specific language impairment. In North America, we're still having quite a bit of difficulty using the term DLD. It is far more popular with our Australian and basically colleagues in UK, as well as on other continents, but not necessarily also popular in Europe, popular in Australia, popular in New Zealand, but not necessarily as much here, although it is growing in acceptance. So specific language impairment overlaps with developmental language disorder, but it has been rejected by the Catalyze panel because it seemed quite a bit restrictive at the time. It implied that the child had sort of pure problems with language in the absence of any other impairments. And as I will show you as we go on and continue in this presentation, that's not actually quite true. So there's actually no evidence that children with a specific language impairment respond differently to intervention or have different causal factors from other children with language problems. So the term DLD is what I use throughout this presentation to refer to children with hidden or overt language deficits. So, what is DLD? Quite simple. Children have difficulty comprehending what is being said to them and expressing self, and it's unrelated to very obvious biomedical issues. So, for example, if a child has autism spectrum disorder, then their language impairment may be related to the fact that they have this neurobiological condition. So they would be termed more as DLD plus. In other words, it would be DLD caused by ASD. If a child has intellectual disability would be a primary diagnosis, and then we would be essentially indicating that, okay, child, this is a DLD plus, the difficulty is due to an intellectual disability. But with DLD, what essentially you see is normal development in all areas, with the exception of content, form, and use of language. So as I said, SLI was an old label, and a recent name change better reflects the type of difficulties the children are going to have. So these difficulties persist into adulthood. They significantly impact functioning, they require additional assistance, and then there's going to be speech pathologists involved in assessment and treatment, and special education placements to be made. Let's take a look. See, we have a few questions. Let me see if they're new or we don't have any new questions, so we can go on. Okay. All right, fantastic. So, all right. Here's an infographic which illustrates the term developmental language disorder. It shows that the child has language difficulties which create barriers to communication or learning in everyday life. The language problems are not likely to be resolved by 5 years of age. Problems are not associated with known biomedical conditions such as brain injury, neurodegenerative conditions, or chromosomal disorders. Now, oftentimes as a speech-language pathologist, I hear that their language abilities are just fine. So what does that exactly mean? Well, the truth of the matter is that this is much like the Russian proverb says, you trust, but you must verify. So when we trust and verify, we really need some means to confirm that. I mentioned before, language difficulties can be covered. Language difficulties may be quite problematic in the sense that they're not easily uncoverable. And I'm going to talk more about that with respect to what kind of assessments can uncover them and show them better and showcase them better, or which kind of assessments are not going to be effective in uncovering language difficulties. So, we have two types of language. We have social language and then we have academic language. When we're talking about social language, we're speaking about everyday interactions. So for example, everyday interactions by either speaking to our friends, colleagues, when we say written form, so for example, text, emails, more informal things. We're texting our friends, we're texting our family, we're using slang, we're using informal language, we can be repetitive, we can use phrases, we don't follow grammar conventions, we write BRB for be right back, and so on and so forth. Then we have actual academic language. Academic language is found in textbooks, research papers, conferences, etc. So you use it for academic purposes. It is more sophisticated. You do it for the purpose of compositions. You do it for the purpose of expressions. We don't, in terms of which are more sophisticated in nature. we use more sophisticated transition words, implementation, moreover, furthermore, and so on and so forth. We will not use slang for usage of academic language for academic purposes. We will use more formal sentences. Our sentences are going to be sophisticated, composed of independent and dependent clauses. So when we're talking about the use of language, especially for the purpose of reading and writing, we are very firmly referring to the nuances of usage of academic language. We're not referring to the fact that the children can speak in compound and complex sentences or with a variety of clauses in regular speech. We're really talking about more complex academic language. And sometimes there is no other way to know if somebody is developing appropriately and if everything is appropriate, but to actually assess a child, especially when there is a very, very strong suspicion. There is a very strong suspicion that language is involved and language is contributing to reading issues. So here are some examples of academic language areas which speech-language pathologists can assess. For example, vocabulary can be assessed, but needs to be assessed very, very carefully. That is one of the reasons, because if you simply assess somebody's ability to point to one of four pictures or label just one picture, that is not functional use of vocabulary. Certainly not for verbal school-age children. It is only functional for young children, children probably preschool age, with very limited vocabulary knowledge. When we're talking about literate vocabulary knowledge, we're talking about complicated words which occur in academic contexts. So then we need to also talk about semantic awareness. Semantic awareness or semantic processes are associated with word reading. Namely, kids read words better when they know their meanings, especially when it comes to appropriate stress placement, appropriately when they're reading certain names of places, which may be difficult to decode because the word stress is different. Similarly, morphological awareness is one hugely important skill, very important, not just for speaking, but also for reading and writing. Our knowledge of prefixes and suffixes, or what we combinedly call affixes, is actually a very, very important knowledge, which plays a huge role in understanding higher level text. Morphological awareness is mediated by vocabulary knowledge. So in other words, we have certain morphological constraints. There are certain words which cannot possibly have certain prefixes or certain suffixes because they're simply not used that way. Morphological awareness is a predictor of reading comprehension between the ages of 6 and 11. And it makes quite a contribution to reading comprehension, beyond your oral vocabulary and word reading skills. So it is a very, very important skill. Somebody asked the question, what assessment tools recommended to test vocabulary knowledge? I will speak more about that when we actually get to the assessment portion. So if you can hold that thought, I would appreciate that, and then I can elaborate further. All right, so I want to also take a moment right now to talk about reading comprehension. Even though we're talking about oral language, I want to emphasize the monumental role oral language plays on reading comprehension. Reading comprehension is not a unitary skill. Reading comprehension is a collection of skills. Solid language abilities are strongly connected and correlated to reading comprehension outcomes. They're also connected to oral vocabulary knowledge. Strong discourse and narrative abilities are very positively correlated with reading comprehension. So is knowledge of literate vocabulary words, not just in isolation, meaning ask somebody to provide a definition of the word esoteric, but also the meaning of the word esoteric in red text. In addition to that, other skills involved in reading comprehension are your background knowledge, what background knowledge you have to work with text, your ability to make inferences, how well you're grasping text structures, and how well you're grasping literary devices. So, this part is very, very important. Oral language plays a monumental role in reading comprehension, because reading comprehension is only very, very limitedly dependent on decoding and reading fluency. And we know that from studies with intellectually impaired children. So in other words, we have children with IQ of, in the 60s, in the 70s, but they are very, very fluent readers. And depending on the level of text, they may be fairly accurate. Having said that, their accuracy is only going to serve them well up until a certain point. Once they hit these words, once they hit words they don't know the meaning of, so their semantic processes cannot be activated. Once they hit certain kind of a ceiling in the area of morphological awareness, then we have a problem. Number one, their accuracy will be very dramatically affected. Number two, their comprehension is definitely going to be hugely impaired, because reading comprehension is dependent on your intellectual quotient. But your reading fluency and your decoding abilities don't. That's why we don't need IQ testing in order to determine if somebody is, in order to, let's say, diagnose dyslexia. We definitely may need IQ testing for the purposes of diagnosing an intellectual disability. That helps us plan what we do with a child. That really helps us the prompts and the cues and the support they need, how we work with them, and how many years of work we're going to do with them. Because if somebody is intellectually impaired, you can certainly try to make them a competent reader as commensurate with their level of oral language, which you will need to keep increasing and increasing and increasing, so their reading abilities keep increasing and increasing. But at the same time, you really need to, ensure that once that decoding component and the reading fluency component is on track, it might take them 3 to 4 years or 4 to 5 years to then stabilize that fluency and become much more fluent and become much more accurate decoder. Their reading comprehension will still continue to be affected. Okay, some examples of oral language deficits children may have. Oh, you know what? I actually want to take a question. How do we know a child is ready to learn reading? Any indicators? Well, to be honest, I don't think there is ever a perfect position or situation where a child is ready to learn reading. You certainly need certain level of oral language, or at least some basics. But we also know that children who receive augmentative and alternative communication, who may be nonverbal, also learn how to read, and there are ways of teaching them as well. So in other words, I would go by developmental milestones. We would apply what we know about typical development and typical development of reading in young children, and we will start introducing children to phonemic awareness, to print, to everything else at that appropriate time. So in other words, if you're supposed to kind of know your letters, know your numbers around the age of 4, that is definitely a good time to keep introducing that, definitely a good time to play with sounds, and so on and so forth. So that is very, very important. And so we don't have to be ready for that perfect aha moment. We can just start with, okay, is it developmentally appropriate to teach them how to read? Yep, it is. Even though they're intellectually impaired? Yep, they are. Okay, no problem. We're just gonna go ahead and start doing that. Okay, so to continue. So oral language is composed of a number of areas. We can have issues in the area of phonology. Phonology is the understanding and use of speech sounds or phonemes. You can have several different types of deficits. Number one, you can have a speech sound disorder. Number one, so with that speech sound disorder, you may have mispronunciations. You may have a phonological disorder, which is affecting classes of sounds versus individual sounds. And you may have what used to be called like a speech impediment. Speech disorders in isolation do not affect reading abilities unless there's a heavy language involvement and unless there is a language involvement in general. So we definitely know that, and we definitely need to keep that in mind. But you can also have a slightly different type of difficulty in the presence of appropriate speech sound production. So what, excuse me, please. So what can you have? Well, you can have a very significant difficulty recalling phonemes. Understanding sounds are connected to letters. Understanding that letters make sounds. You can have difficulty manipulating sounds, isolating them in words, isolating the beginning, middle, or the ending of words. You can have difficulties on all of these areas, and that is generally kind of a red flag for reading difficulties. So phonology definitely plays a huge role in learning to read, and it is very much a language-based skill. Another language-based skill I briefly touched upon is morphology, understanding and use of word parts, including morphemes, affixes, and so on and so forth. Vocabulary and semantics. Child may have restricted lexicon and difficulty manipulating words. What do I mean by word manipulation? Typically, a really good test is not the one that asks children to label, but a really good test is something that asks children to manipulate. Give me a synonym, give me an antonym. Tell me what the word rose means in the sentence. The sun rose above the mountain. Tell me what are some interpretations of the fish was ready to eat. So, his bark is worse than his bite. Well, what does that mean? These are examples of deeper comprehension of vocabulary, deeper manipulation of vocabulary. Tell me two meanings of the word cast. Okay, now in this sentence, the word charged is used with respect to which meaning. This is what's important when it comes to vocabulary manipulation. So somebody asked me, what kind of tests can be administered? I've written an article on my blog, Smart Speech Therapy, and that is, I don't remember the exact name of it, but I believe it references the functional, how functional are vocabulary texts. When I'm doing Q&A portion of today's presentation, I'm gonna dig out the link and pass it over in the chat option. So what's gonna happen is that's the vocabulary we need to look at. We really need to look at those vocabulary words and how they're manipulated in order to start understanding. Can the child use that vocabulary in sentences? But it doesn't stop there. We really want to understand the more sophisticated usage of vocabulary. We really want to know how the child uses these vocabulary words in discourse and in stories. So if we're looking at oral language, and if we're looking at the kind of important area of oral language to assess, discourse and narratives would absolutely be the integral part of every single oral language assessment. So that's going to be hugely important. You really, really need to assess those narratives to understand how is the child using vocabulary in the context of stories. That is far more functional than just working on labeling. So you can always do both. You can assess semantic manipulation, tests such as word test, the version 3 and the adolescent version assess vocabulary. The expressive language test, I believe the second version, has portions which assess definitions. There are portions of the clinical assessment of language fundamentals, the meta-linguistic edition, which assesses ambiguous and figurative language. There is vocabulary awareness subtest, the test of integrated language and literacy, which assesses that cognitive manipulation of vocabulary. Those are the tests we really ought to be administering if we want to know whether the child's vocabulary is robust or poor, and whether, even despite that robustness, are they able to use it for conversational as well as discourse purposes. So, two other important areas are syntax, understanding and use of complex sentence structures, especially when they are reading, especially when they're speaking, and pragmatics, understanding and use of language in social context. That is very, very important. Social pragmatic deficits play a very, very huge role in essentially contributing to the maintenance of a disorder. Pragmatic deficits play a monumental role, not just in oral language, but they're very, very hugely impactful for reading purposes and for writing purposes. Pragmatics really, really affect the way you comprehend grade level text. And with respect to writing, pragmatics really affects your written composition. The complexity of your essay, the productivity of your essay, the word usage, and so on and so forth. That is going to be profoundly affected to a very significant degree and will appear more impaired and immature, secondary to hidden or overt pragmatic deficits. And I do mention specific tests with strong psychometric properties, which is useful for that purpose. So we also know that research shows that oral language deficits place children at a higher risk for dyslexia. Research also shows that having a developmental language disorder places children at a higher risk for developing reading deficits. As you can see, this is very much a chicken or the egg situation. So this is very much a chicken or the egg situation. So that is why it is hugely important to assess oral language and to make sure that it is a very necessary component of all literacy evaluations. And if the examiner is only assessing literacy and is not assessing, if the examiner is assessing literacy and is not assessing oral language, then someone else needs to jump in and assess the missing areas. Because if you don't, child will continue to fall farther and farther behind in school. So someone asked me regarding how pragmatic language deficits affect reading and writing. As I mentioned before, they significantly affect reading comprehension and written composition. But usually this is because they have so much content. This is not the best place to address that, given just the huge host of questions that I have. So I will, so this is going to be something that can be addressed in a different presentation. So to continue, social communication, pragmatics, whatever way you want to call it, We have study upon study upon study that shows that language and reading deficits are associated with depression, anxiety, attention, as well as behavioral problems. So those are some of the studies listed there. Studies also show that there is a significant connection between psychiatric impairments and poor social pragmatic functioning. So for example, Benner, Nelson, and Epstein examined 26 studies that addressed students with emotional behavioral disturbances and language deficits, and it found that 71% of students were identified with pragmatic language deficits. Nancy Cohen's study with colleagues from 1998, it found that common difficulties when it came to social communication and pragmatics were in the area of emotion decoding and social problem solving. Bryan 1991 study found that children with social communication difficulties present with significant difficulties understanding another person's affective state. So why are we mentioning all of this? Well, because children with language impairments are impaired in multiple areas. If you have impairment in the area of oral language, you do have impairment in the area of how you use your language or that pragmatic language piece. So what researchers found is that if kids have language deficits and if they manifest pragmatic difficulties in conversational partners, then they really have a lot of trouble adjusting their needs to others in social interactions. These kids are less accepted by their peers. They don't have the same quality friendships as they're typically developing friends or peers. They're typically perceived by teachers as being more withdrawn as compared to their peers, and they're judged as presenting with far poorer emotional competence and emotional intelligence. So research indicates that kids with language impairment or DLD also present with concomitant social communication difficulties. If they're left untreated, it will significantly adversely affect their academic outcomes, reading and writing, and future life success. Now, one of the things which I hear quite often is people swear up and down, teachers and parents, the child's social skills are just fine. The problem is that these difficulties could be internalizing versus externalizing. Very briefly, internalizing is when you keep your difficulties to yourself, you bottle it up. So for example, a number of kids with anxiety may be internalizers. So they may be constantly fretting and obsessing and presenting with these symptoms of inattention, hyperactivity, impulsivity, because their mind is constantly anxious and is revolving around them. It is really revolving around the fact, whatever they're preoccupied with. But the issue is that they may not be acting out. They may be a little more taciturn. It may show that they have friends, but you may notice something interesting if you start looking at the quality of their friendships. It may look that they are more followers versus leaders, or it may look like, if they have different types of social difficulties, they may be very bossy and they may be friends with kids who may have similar social difficulties. On the other hand, externalizing manifestations are quite easy to spot. These are behavioral difficulties. So these are behavioral difficulties which are, they are very apparent. They're usually first noticed by teachers and parents. So, and because of that, it's much easier to spot them. It's sometimes much easier to assess them and intervene. It is much more difficult with internalizing expectations. So, how do we solve that? Well, we need to administer appropriate social pragmatic language assessments, because how else are we going to know if they truly are impaired? If we are to rule something out, we really need to address it in an appropriate manner. Social pragmatic assessments are not routinely administered in numerous school settings. Absolutely not. They're usually almost never a part of comprehensive language assessments, although that has been changing lately. And furthermore, I really want to emphasize as much as possible and as concretely as possible, pragmatic abilities or social communication abilities, they must be a required component of all language and literacy assessments, because they really do affect not just oral language competence, but they really do affect reading and writing. And if you have pragmatic language difficulties, your reading and writing abilities are not going to be as competent as those kids who do not have those difficulties. Let's take a look. I believe I saw some more questions. Okay. To state to everybody, so you guys don't ask, handouts are not available yet. Handouts were going to be available after the presentation. So what I'm going to do after the presentation, I'm going to edit and upload this video on Facebook as well as on YouTube and share that. If I'm going to continue have difficulties, then what I'm going to do, I'm going to volunteer my time to do another webinar on exactly the same topic. So all the other people who couldn't get in today because of monumental Zoom issues would be able to get in, because it's really not fair to them. And I've already done approximately 10 of these events. And this is the very first time I received such issues. So handouts will be available in the SLPs for Evidence-Based Practice group on Facebook at the completion of this talk. And then they will be available at some point tomorrow, unless I can put them there today, if I have the opportunity. But I will be spending most of my time after this talk trying to figure out why did this go monumentally and spectacularly flamingly wrong. So, to continue. Let's talk a little bit about dyslexia, because I'm sure that many children who present with reading difficulties, it is suggested at one point or another, somebody's having dyslexia. So let's talk a little bit about dyslexia to put everything in context. Number one, it is very recognized that it is a language-based difficulty. IDA, or International Dyslexia Association, recognizes the fact that these difficulties result, whatever difficulties the children having, when they read, result from a phonological component of language, which is unexpected in relation to blah, blah, blah. Their secondary consequences may include problems in reading comprehension. This is one example of those secondary consequences. Reduced reading experience, and it will impede the growth of their vocabulary and background knowledge, both very much language-based areas. So this is, again, a chicken or the egg situation. Kids with great vocabularies are really great readers. Kids who don't have such great vocabularies will lag further and further behind typically developing peers, because in approximately 4th grade, you really start learning from text. You do not learn from oral language, from what your teachers and parents tell you. Simply because if you read a book, by the sheer virtue of reading that book, you will all of a sudden acquire a ton more words than you would have heard in conversation. So that divide and that chasm, it really, really just widens very, very significantly so. And because of that, we have a problem when it comes to vocabulary knowledge. So in other words, poor readers already suffer from the fact that their vocabularies may be affected, and the older they get, and the more difficulties they're having, their vocabularies are still much smaller than peers without reading deficits. So again, many researchers have confirmed that dyslexia is a language-based disorder. American Academy of Pediatrics actually had to put out a statement in 2009 because there was a very significant misperception that dyslexia is somehow related to vision. So they really had to emphasize it's a language-based disorder. Because dyslexia has been defined as a language-based disability, again, it is very important to assess foundational areas of language to determine whether the child presents with hidden oral language deficits, which are affecting their ability to read and to write. So, let's talk a little bit about dyslexia controversy, because that is an absolute must, which has to be mentioned. Now, what are we talking about? Well, the controversy is as follows. Dyslexia is defined quite differently in different studies. You can take 10 different studies, and in 10 different studies, you will get different definitions. In one study, it will be struggle in the area of phonemic awareness or sound manipulation. In another study, it will be the child's difficulty with clearly reading and decoding single words. In yet another study, dyslexia will be defined in a nebulous fashion, such as, well, it can be explained by any alternative factors. It's not due to anything else, which is very vague. In yet another study, it could be defined as a significant reading performance discrepancy. So significant discrepancy between reading and IQ. That is not an evidence-based method to define it, it's just so we know. It could be defined as phonological or rapid naming deficits. It could be defined as failure to make meaningful progress in reading even after evidence-based reading instruction, whatever that evidence-based reading instruction may be. Now, there is also, along with dyslexia, there is this belief in what we call unsubstantiated dyslexia subtypes. So then people start throwing out phrases such as phonological dyslexia, surface dyslexia, double deficit dyslexia. Here's the problem. Research actually does not support any of these subtypes in a meaningful way because they don't really drive treatment. What we do know about kids with so-called dyslexia is that their reading deficits are very heterogeneous. They're very dramatically different. They're not all uniform. So if we're looking at it from a perspective of dyslexia subtypes, there is an awful lot of subtypes, but the problem is studies can't seem to confirm that it is a valid, specific, and standalone diagnosis. So another big problem when it comes to dyslexia, there seems to be this sort of like artificially created divide between poor readers who are artificially separated. Okay, you guys are dyslexic and you guys are non-dyslexic. The problem is it has absolutely no scientific rationale behind it, because guess what? These readers will display very similar pattern of difficulties, and yet what the problem is that depending on who you go to for diagnosis, depending on your race, and depending on your socioeconomic status, you may be labeled as dyslexic or you may be labeled as non-dyslexic. The problem is the rationale based on which you are labeled absolutely lacks validity and substance. Then we have some interesting studies which show us that you take a bunch of different evaluators, and a bunch of different evaluators will basically assess dyslexia quite differently. So this different assessment of dyslexia will actually result in, number one, completely questionable interpretation of literacy difficulties. Number two, there's going to be this commitment to a very outdated discrepancy model. The IQ is the reading difficulties do not match IQ, or there's a significant discrepancy between ability and reading. Then a lot of examiners don't really use sound standardized testing practices in order to effectively test for reading difficulties. And that's a big problem, because when you use a variety of non-standardized measures, that is hugely subjective, and that usually brings you into a world of trouble. So there is also lack of appropriate clinical testing properties that article found when it comes to different examiners, and there is also over-reliance on professional observation and experience above test results. So the bottom line is the dyslexia controversy is as such that the term does not contribute to understanding of what the deficits the student is experiencing in the area of literacy. So when I do my reports, I am not interested in making the diagnosis of dyslexia. That does not help me, the child, or the treating therapist or professional who's working with the child. What will help them is me doing very deep testing, indicating and outlining all the areas of difficulty the child experiences, be that in the area of phonological awareness, phonemic awareness, decoding, reading fluency, reading comprehension, and so on and so forth. And that's what I look at. Based on that, I'm going to formulate very specific and targeted goals. These goals are going to be evidence-based. These goals can be used pretty much by anyone to then appropriately formulate treatment so the child would improve abilities. That is what's important to me. But giving somebody a test and then saying, okay, well, they have dyslexia. Okay, what are you treating? What are you looking at? So a lot of times we get, a lot of times there's this belief, well, the school districts don't know of these children, but at least if you use the term dyslexia, it is better. And my answer in those situations is actually school districts still don't know what to do, with children, whether or not you diagnose them with reading disability or dyslexia, because it has nothing to do with the label. It has to do, are you a competent assessor of reading? Because if you're a competent assessor of reading, you don't need labels, because you are looking at deficit areas, because that's how you're going to formulate your goals and objectives. But if somebody tells me this child has dyslexia, I'm at a loss. I have no idea what that means. Okay, well, what do they have difficulties with? Do they have difficulty on decoding at single word level? How's their phonemic awareness abilities? Oh, what about their reading fluency? Are they reading text fluently and accurately? I don't know any of that. So that's the problem, and that's one of the issues. Let's take a look if there are some additional questions. Oops, sorry. Okay. So there is the other side of that coin. Is it language disorder or learning disability? So if we're not labeling somebody as dyslexic, if we're not labeling somebody as, language disordered, what if we're labeling them learning disabled? So let's talk about those terms. So a lot of times what people don't necessarily readily understand is that if a child presents with difficulties in the area of oral language, that will definitely affect more complex area of language, such as reading and writing. So many children with language disorders are going to be later classified with a learning disability because their later learning difficulties took on a form of problems, acquiring higher level of spoken language comprehension and expression. Sometimes when we have kids with language difficulties, they go through what we call a process of illusory recovery. That's a time period when students with early language disorders seem to catch up with their typically developing peers because they have this spurt of language learning, which has been essentially promoted because they've been receiving good quality language therapy services. The problem is it's going to be followed by a post-spurt plateau because due to their ongoing deficits and an increase in academic demands, many kids with early language disorders will fail to outgrow these difficulties and catch up with their typically developing peers. So the problem is that we have different professionals who use different labels in different contexts. What that should not obscure is the gestalt. It should not obscure the big picture. Here's the big picture. These kids who are being labeled as having auditory processing disorder or dyslexia or learning disability, they have specific commonalities. What the commonalities reveal is that they all have deficits in the areas of oral language, reading, writing, and sometimes spelling. Those are the commonalities. Those are the common problems. Those are the things we need to uncover and effectively treat, regardless of whatever label is given to the child. We don't treat labels. Labels don't help us treat. We treat uncovered areas of deficits based on which we formulate goals. So, somebody's asking, is it a common profile for a child with dyslexia to have strong oral language skills but weak expressive language, writing and spelling? In other words, can they speak very articulately but struggle to transfer their knowledge to print? This is a hard question to answer. One of the reasons why is because when I administer my assessments, I actually do not find that they speak very articulately. What I do find is that they actually cannot express themselves articulately under certain quite common test conditions. So in other words, they're in a testing room, quiet, nice space, I'm trying to be friendly, all is good. I start asking them questions. What I start finding out is that they may be very articulate with respect to their social language, but their academic language is by no means very articulate. And this is where the problem lies. So yes, you have a number of kids with reading deficits who present with seemingly very strong oral language abilities. That is not always the case when you start testing them. When you start testing them, you will actually see their language abilities, they're fooling you, and their oral language abilities are not as strong and not as sophisticated than you originally thought. So that's my answer why, to your question. That is why we need sophisticated tests to uncover sophisticated difficulties. If you use very basic tests, you're actually not going to uncover a difficulty at all. So going back to the article, what we have is that research, longitudinal research, refers to research which follows up groups of kids for years and years and years and years. What it shows is that these kids with early language disorders, they actually experience difficulties in all domains of academic achievement: spelling, reading comprehension, word identification, word attack. So many kids with language impairments are diagnosed with dyscalculia. There is a very significant language and linguistic component in math. There are word problems. You need to really understand your formulation for those word problems to be an effective mathematician, for lack of better words, to be good at math. So, again, we're going back to the same thing over and over again. Children with language disorders will be classified with learning difficulties because these learning difficulties are now taking on more sophisticated and different forms. And now they're actually being expressed in reading and writing. Somebody's asked if I'm going to share the names of the assessments that I use to identify language weaknesses. You're going to notice something. Somebody mentioned two tests, CTOP2 and SELF. I'm actually, I'm going to mention something about the SELF, and I use the CTOP2 definitely for very narrow purposes, but today it's definitely not even going to be on the list of assessments I'm going to be briefly discussing. So to continue, moving on. Risk factors. We said we're going to talk about risk factors for reading impairments, risk factors for language and literacy disorders. Very briefly, something parents really need to be aware of when they're trying to figure out, does my child have a language difficulty? Am I certain the child has a difficulty or not? So what is the matter? So, genetic syndromes. That certainly will contribute to language deficits and learning impairments. Intellectual disability, absolutely. Family history, genetic inheritance plays a monumental role in language, reading, writing, and everything else. Your speech-language delay, your dyslexia, your learning disability, your psychiatric diagnosis, hugely heritable, significantly so. One of the recent studies, for example, has found out that 80% of autistic spectrum disorders is heritable, and the rest of them involve a variety of mutations. This is, of course, putting it very, in a very kind of grossly overblown manner in terms of very crudely, but at the same time, when we're looking at certain things, typically a small number of genetic alterations, spontaneous genetic alterations, will result in these type of difficulties. Most often, you can actually, when you dig deep enough, you will locate that relative, that brother, cousin, auntie, a grandpa who had similar difficulties. And genetics are a very, very funny thing. They are heritable in a very, very interesting way. They're not always, it could be, obviously this is not a session for genetics, but when we talk about, recessive and dominant genes and so on and so forth, when we talk about skipping in a generation and so on and so forth, genetics are very tricky. But certainly family history is, when you know that there is a family history, you start ringing the alarm bells early, because you want good quality treatment for the child, because the earlier the treatment, the better quality is the treatment, the more amazing the outcomes are. Because I cannot tell you how many kids I assessed and treated who went on to have fabulous college experience, who went on to have lovely jobs, simply because somebody jumped in quickly, intervened appropriately, improvements were made. Again, developmental history has a lot of red flags: adoption, foster care, history of early childhood abuse, neglect, trauma. All of these things possess an incredible role in language. Delayed disorder language development. Somebody, you can't readily locate, family member with these difficulties, but the child is clearly learning impaired. You're getting early intervention services, you're getting preschool disabled services, and so on and so forth. And it's clearly obvious the child is having difficulties. So red flag for later reading issues. Social communication behavioral deficits, that's my specialty. I work for a psychiatric hospital. I work with psychiatrically impaired kids. This is what I see very, very frequently. Kids with social communication behavioral deficits have significant language impairments and certainly concomitant reading difficulties. Early emerged learning deficits, I've assessed some kids who showed that, and it was actually excellent when parents bring them in early, because the outcomes are really fantastic for those kids. But we're talking about your little 4-year-olds, we're talking about your little 5-year-olds who are having difficulty counting, reciting letters of the alphabet. They have poor memory for names. They don't really know novel words. Those are your little buddies that you need to really pay attention to, because with appropriate intervention, those kids will absolutely thrive. But it is a red flag and they need to be watched. And then, of course, we have what we call idiopathicization. We have no recognizable family history of learning disabilities, but yet they display a pattern of those linguistic difficulties during early development. And some of it could be due to those genetic alterations. So if a child experiences any difficulties in the foundational areas of language, such as listening and speaking, they will most certainly experience difficulties in the more complex areas of language, such as reading, writing, and spelling. To continue, here's your warning signs of literacy deficits in young children. We have documented history of language impairment. They received speech therapy services from an early age. They received early intervention. They received preschool disabled eligibility. They may not have been picked up for language as little guys, but they got picked up for language because of early onset literacy difficulties. So as your 5-year-olds and as your 4-year-olds could not do nursery rhymes and songs, again, remembering letters of the alphabet, and even without a family history of learning disabilities, it may be very important for kids to have an early literacy assessment to determine whether intervention is warranted. So, what are the implications for assessment? Well, because so many kids with developmental language disorder may not show academic or language-related learning difficulties until those linguistic and cognitive demands of the task increase and exceed their limited abilities. Speech pathologists, as well as everybody else, as well as educators, we really must consider the underlying deficits that may be masked by early language development. And we must evaluate the child's language abilities in all modalities. And that includes pre-literacy skills, literacy skills, and what we call metalinguistic skills and abilities. And metalinguistics refers to your ability to think about language. Meta, think, linguistic language. To continue, want to make sure we cover everything. There are 37 slides for this presentation, and I want to make sure we adequately cover them. Assessment process. I cannot emphasize enough the importance, not just that data collection, not just the review of records, but also informed way to do an assessment. You cannot just go in blindly into the assessment. That is not done. You will not adequately assess deficit areas. It is wrong. You need to have referral forms and checklists. You need to prepare in advance what you're going to assess. You don't do that in the middle of an assessment. That is not going to serve you well. You need to go in advance and know what you're stepping into. You cannot assess everything. That is not humanly possible. You cannot waste time. You need to target only deficit areas. And very important to understand, not all general comprehensive language assessments are alike, because this is when we talk about psychometric properties of language or the discriminant accuracy of language tests. In other words, are those tests adequate for the determination of a language disability? And that's not always the case. Let's see what we have. Here's an example for some of my checklists, which I routinely used. I picked just 2 areas. There's certainly lots more. But if you see, this is starting to give me an idea of what kind of test I want to use. Do I want to use narrative sampling? What type of vocabulary do I want to give to the child? These things are hugely, hugely important. We want to know that. I wanted to alert people, please don't ask me questions in chat. Please post them in the Q&A section. It's difficult to follow everything, so Q&A section is where I will try to answer all of the questions. So, to continue, let's talk about common assessment limitations. I definitely want to spend adequate amount of time on this line. Here's why. What are some issues the child continues to struggle? Number 1, they used the wrong test. The test didn't uncover deficits. So, if your test had a huge number of kids with language and learning disorders in a normative sample, that's going to be mighty difficult for you to determine typical development from language impairment. So, here's a perfect example. And it's not only the SAL-5 which is a culprit. I don't want to be specifically targeting that test. I can tell you that there are numerous other tests, comprehensive tests such as CASTEL and RESCA, which have limitations. So, in the SAL-5, its most popularly reviewed test, there were 3,000 kids in a normative sample. The problem is that they've identified 23% of kids with language and learning needs. That is a problem. That means that this test is not going to do a great job at uncovering core language deficits. 23% of kids with language impairment is a whopping number of kids to have in a test which purportedly needs to separate typical development from atypical development. That is why what happens with SAL-5 is what we call score overinflation. Child can barely speak, child is doing really poorly in school setting, and yet on the test, child is coming up smelling of roses. And parents and teachers may be thinking, wait, how is this possible? Well, this may be one reason why. Because it didn't have appropriate discriminant accuracy. And because the cut scores in the test were used incorrectly. So it could be a combination of factors, so one needs to be really on the lookout. They really need to look at the list of tests and determine, were appropriate tests used? Is everything what it should be? Should they have used other tests? If so, what kind? Okay, there is something else. Tests don't have to be psychometrically weak and have poor discriminant accuracy. Tests could just be simply inappropriate. Here's a perfect example. There is a prevailing desire and pattern of use in a number of districts which use one-word vocabulary tests, such as the expressive one-word vocabulary test and the receptive one-word vocabulary test. Here's the problem. These tests possess no value for school-age verbal children because your ability to point to 1 out of 4 pictures and your ability to label words if you are verbal and you have higher level abilities is not indicative of your ability to use language competently. So what we need instead are those semantic flexibility tasks, those vocabulary manipulation tasks, because what we know as per research, that these vocabulary tests have poor psychometric properties. They're not representative of linguistic competence embedded in life activities. They're not represented in these more sophisticated conversations or in academics, and that's a problem. Now, another very common assessment limitation. Well, they didn't look at all the deficit areas. So, for example, parents and teachers indicated that the child presents with difficulty in the area of narratives, but nobody assessed narratives. Or they took a language sample, but they shouldn't have used the language sample because the child is way too old. But then, on top of everything else, that language sample is interpreted inappropriately. Child is showing deficits in spades, but the examiner did not interpret that correctly. Here's a perfect example of that. Assessment results were misinterpreted. So, for example, you give somebody a criterion test of reading. You will note that the child presented with difficulties in the areas of morphological awareness, decoding. They were guessing at words, they were inappropriately reading common-looking words, and yet nothing happened. And yet it was interpreted that the child is reading appropriately, but that's not true. The test clearly showed there's lots and lots of difficulties, but somehow it was decided, oh, no, they're not really representative of that. Another example of that is use of cognitive referencing. So, for example, I've had a very unfortunate experience of a neuropsychologist giving a battery of tests to a child and then basically saying, well, all the areas are affected. There are poor scores in everything, so I can't make a determination if that's a learning disability. And my first thought was, are you kidding me? That is actually exactly how you do determine there is a learning disability. There are poor scores across the board. Child is struggling. Child is illiterate. Child definitely has a problem. We're not looking for a discrepancy between average IQ and poor reading abilities. We're looking at what's functional, and that's what's not done. Finally, this is the saddest part. Somebody did a decent assessment, but then, unfortunately, used erroneous goals. So, for example, they use some goals which shouldn't have been given to the child because they're meaningless. They don't generalize well across the board. They don't result in academic language competence. So, that is one example of that. Comprehensive educational assessments. Assessments like Woodcock-Johnson, tests of achievement in oral language, the Wechsler, the CATIA, they really have been developed to rank kids within the range of a general population. They don't mention sensitivity and specificity in their technical manuals. Because of that, their discriminant accuracy for the purpose of disorder identification is not known. So, children will do quite well in these tests, but may be reading and writing or oral language impaired. So, because these tests were not created for the purpose of disorder identification, they really need to be used judiciously. Here are some tests which do have good psychometric properties. For example, assessment of literacy and language, all. It's used to be published by Pearson, has been re-released by Ventris Learning. Starts at pre-K through first grade, takes about 60 minutes to administer, has really good sensitivity and specificity, which basically means it's accurate at identifying impaired kids and accurate at keeping typically developing kids out of that identified zone. Has lots of assessment areas: listening comprehension, spoken language, phonological awareness, alphabetic knowledge, and print awareness and fluency. This is what it looks like. You will see that more in the handouts. You basically have 3 little different areas of how you're assessing them. You start with initial indicator test. That's going to tell you what to do for diagnostic purposes, and then it's going to tell you how to supplement. But no, you don't administer all the tests. Basically, based on how the kids do, you figure out which subtests to administer and in which direction to move. On the right-hand side, we basically have explanations of what kids need to do. They're pointing at pictures, they're completing phrases or sentences, they're describing the relationship between words, always excellent identification of problem solving. They test their rhyme knowledge, their ability to categorize sounds, and also delete syllables. Their letter knowledge and their phonics knowledge is tested, and so is their spelling. And then they look at a few other skills. Mentioned this test before, comprehensive assessment of language and literacy, comprehensive test of integrated language and literacy. This one is for older kids, essentially 6 through 18 years of age. It looks at some solid literacy skills, including fluency, comprehension, awareness, spelling, and writing. It has excellent sensitivity and specificity, particularly for each group level, and it is standardized to identify language and literacy disorders. It has much better diagnostic accuracy than other tests for that age group on the market. So when somebody's asking me, what do I use? This is a test which is my go-to, depending on what additional areas of difficulty child exhibits, I heavily supplement with a number of other assessments, because even the developers of all tests will tell you no standardized test is perfect. They all have limitations, but it is a lot easier to live with those limitations if the psychometric properties of these tests are sound. This is just an example of what COT scores in the identification course for each age. So you administer different subtests to different age groups to understand if somebody is language impaired or not. For subtle deficits, you really need to administer supplemental assessments. You really need to look at narratives, you need to look at social communication, you really need to look at comprehension, and you need to look at written composition. You can do so clinically by designing specific tasks which will be useful to you for identification of those hidden deficits. Somebody mentioned social communication. What is the test I recommend? Well, I recommend assessing pragmatics through clinical assessment of pragmatics. As you can see, it has some pretty nice sensitivity and specificity. It had not only students with autism spectrum disorder, but also students with learning disabilities, as well as language impairments. And this test, I use this test very frequently in my at my job, and I find it very consistently correct in identifying kids with pragmatic language difficulties, including those kids where parents basically didn't even fill out the pragmatic portion of my intakes because they basically said, oh, these kids are okay. When I administer this test, I do locate difficulties. Conclusion. And then I will move on to the portion with the questions, and I'll be happy to answer all of them. Because students with reading difficulties continue to be underserved in the schools, it is hugely important to assess not just their reading, but their oral language abilities. We need to give them psychometrically sound standardized assessments. We need to give them solid language assessments because we really want to adequately reflect their difficulties in the real world, not just in the testing environment. It's very important to make sure that the assessments yield diagnostic information, which is needed to formulate treatment goals for the students, and all students need to receive fair and appropriate assessments, which will result in targeted and relevant therapeutic services. The problem is that if we provide anything less, that is actually denial of FAPE, free and appropriate education. And we really don't want to do that. And finally, it's very important to know it's really never too late to help. We can help students at any stage in the game, from tiny little tots to college students. I actually have referred out college students who are absolutely thriving, who are doing incredibly well with intervention, even though they started receiving it at college age. So it really is never too late. This is my contact information. Highly recommend, because of all the hoopla involved with Zoom and Facebook today, highly recommend taking a snapshot or a picture of that if you want to reach me. So where you guys see group, www.facebook.com/groups/EBP SLPs. another slash. This is where the handouts are going to be posted shortly. This is also where I intend to share this video once I'm able to upload it. As I mentioned before, with the video right now, I'm gonna try to edit it and upload it on Facebook. That's going to be uploaded on my business page, smartspeechtherapy.com. Once that is uploaded, it will be in the pinned post in the video section as well as in the pinned post of the page. People will be able to use it for their own purposes, share it in any group or page they like, and you would be able to see everything there. I'll also share it on Twitter. So now I'm going to stop sharing my screen and I'm going to try to address as many questions as possible. So some people are saying it will not, some people can't add to Q&A, which is, I don't know what's going on today, but it's been a bit of a nightmare. I'm hoping the video recording is going to, convert, because otherwise it's going to be, okay. Somebody asked me, do you ever use informal reading inventories? I actually do not. What I prefer to use is standardized tests. So I actually did a presentation and it's called, I'm going to share my screen right now and show you what it is called. You can still find it in the EBP group. You can find the video. No issues with uploading that video on Facebook happens. So this is the name of that presentation where I talk about why I don't use reading inventories. I talk about measurement and interpretation of standardized reading assessments for professionals and parents. I did that presentation about a month ago or so. You can find it in the video section of my Smart Speech page. You can find the handouts in the EBP group. There, I don't use reading inventories because I find a combination of standardized testing and clinical assessment measures to be a lot more reliable for my purposes. It's just the way I'm wired. I really am very reluctant to look at reading inventories. There simply seems to be quite a bit, there could be a bit of a room for error and misinterpretation. Okay, let's take a look at some of the other questions. Because somebody had trouble with chat, I'll take a question from chat. When you have 5 or 6 year olds who may have some red flags, such as family history, naming issues, what kind of assessment would you recommend? 5 or 6 year olds are certainly old enough for comprehensive language and literacy assessment. I have assessed a ton of kids, 5 and 6 year olds, for comprehensive language and literacy. So you can easily find specialist and you can go ahead and assess them. No issues there. You can easily do a comprehensive language and literacy assessment. Okay, let's take a look at some of the more questions. So Facebook page, I gave you the information about that. Somebody asked me to describe the importance of multidisciplinary evaluation as a comprehensive team assessment. So collaborate with your team members, decide which areas you're going to assess and why, allocate services, and go ahead. So multidisciplinary evaluations are very important, but multidisciplinary evaluations have to be evidence-based, have to rely on the science of reading. They have to make sense from a scientific basis. Okay. For following directions for first graders would be some good targets. Well, there is a document in the SLPs for Evidence-Based Practice group in Facebook, which actually tells you what did those assessment measures actually target. So following directions is actually commensurate with reading difficulties. So what you're actually going to be targeting when it comes to following directions, you're actually going to be looking at their vocabulary, you're going to be looking at their semantics, you're going to be looking at their syntax, you're going to be looking at their grammar. Those are the goals you're going to be formulating for your first graders who cannot follow directions. Because you got to figure out, why do they have difficulty following directions? Is it because the directions are too complicated, too many words? Do they have difficulty retaining them in memory? So first, you're going to need to figure out what happened. Then you're going to need to do both language and literacy target goals. And that's going to be far more effective than following directions. Somebody asked me about the OLL. The OLL test is available at this time. They do have online administration. It is available from the company called Ventris Learning, VENTRIS. Ventris Learning. If you Google Ventris Learning, you will see OLL is available through both purchased and online administration. What do I think of the test of narrative language? Well, I know the test of narrative language has significant limitations. We've actually discussed it very, very extensively, very significantly in the group SLPs for evidence-based practice. So this is where you will find a lot of information that the test of narrative language, unfortunately, is not truly representative of true narrative language. So you can do spectacularly well in that test and be really, really bad at narrative language. So I highly recommend narrative sampling instead. And I did a number of presentations in that area. If you email me, I'll give you some recommendations. So some questions I'm not able to answer because they're too technical and it requires a lot of hypotheticals. So I'm sorry, Lisa, but to answering higher level questions, such as making inferences, I really need a lot more background information. And so this is not, so it wouldn't be a good use of my time to discuss that at this juncture, especially since we're out of time. Somebody asked me about the TOEFL. TOEFL is again another non-functional test of pragmatics. It is sensitive to rules of politeness, but not much else. So no, I do not recommend it. What does therapy remediation look like for kids in 7th, 8th, and 9th grade not classified due to not enough discrepancy, but who has struggled over the years? Well, the therapy is going to look what assessment looks like. So first we need a comprehensive assessment, and then we determine what the therapy will look like. Without a comprehensive assessment, I have no clue what that therapy will look like, simply because that's really why they're struggling. How could you create a therapeutic goal for somebody who's never been assessed? It's sort of like looking for a needle in a haystack, or being really, really bad at dart throwing and just trying to shoot a dart at a board, but ending up somewhere in the wall. So unfortunately, without appropriate assessment, I wouldn't be able to tell you what that looks like. One more question. What would I recommend for a child who is 7 years old and receives reading services in the school? Or a language does not match the SELF-5, very, very common. He scored really well in SELF-5, but presents with word finding and thought organization. Well, I recommend joint administration of the TILs in conjunction with a nice clinical narrative sample. You will immediately see all glaring deficit areas and will be able to formulate your goals based on that. All right, you guys, it is 8:10 p.m. and we have no more questions. So at this juncture, I'm going to ask if Jamie has any parting words for, for the crowd. And then I'm just going to say my goodbyes.
Thank you so much, Tatyana. We really, really appreciate it. I know in spite of this,
you may be getting another one, especially because I feel so bad that this was a spectacular disaster. Because I feel so bad because I'm going to be afraid to go on social media. I am getting so many messages and people are quite angry. So I'm going to be hiding under the bed quite soon. So I may have to promise another one just to get the, just to get the mob off my back.
Well, this will be the teaser, and I think so many people are really, really interested in so much of this information. What I always appreciate about listening to you is that you really give the details and the rationale and the evidence about why something should or should not be done, or something should or should not be explored. And this is information that parents and professionals really seek. So I very, very much appreciate your time and energy for this. Thank you.
Oh, thank you so much. I have time for one more question from Anonymous. Is there a strong correlation between weak language and orthographic mapping skills? Not always. And I have to look at the studies. I have to look at the studies on orthographic mapping. And I can honestly tell you that quite a number of those studies probably never assessed that. So I don't think that many people who run the studies necessarily looked at both. But if we look at kids, so there may be some correlation, but I don't know regarding its statistical or clinical significance. So my answer to you would be, I would need to investigate this further because I simply do not have enough knowledge in this area. Okay, well, it's been a pleasure, you guys. I apologize for all the technical difficulties. It's always a pleasure to see everybody. I recognize some names. I also recognize a lot of names who are blowing up my phone. Thank you so very, very much for being here, and have a wonderful rest of the day, night, depending on where you are, on which continent. It's been a pleasure. Until next time, take care.